Okay, so it's 3 minutes after 5. I do want to be mindful and respectful of everyone's time. So I am gonna go ahead and get us started. But good morning, everyone. Thank you so much for being here, especially knowing that this is after hours for most folks to attend the info session on this new funding opportunity we just released last Friday for the targeted outreach and program navigation program. And as I've mentioned in the email announcement, and I posted earlier in the chat, just a quick disclaimer that this session is being recorded and it will be posted later within the next few business days on our webpage, just in case there are folks who wanted to attend today's session but who can't be here today or for tomorrow's session. So I appreciate y'all's understanding in advance. All right, so before we begin, I would like to kind of briefly introduce y'all, the sort of the core team here at ECHO, who's been working hard behind the scenes to get this solicitation up and running. And I believe we are all here today on this call. So we do have Kat Hammer, who is our Director of Permanent Housing, and she will be overseeing primarily the operations of this new program, including any training and technical assistance that may be needed for awardees for this program. We also have Maya Leitari, Director of Homelessness Response System Planning, who is basically overseeing the solicitation aspect of this program. We also have my lovely coworker, Bill Wallace, our new capacity building manager, and he will be primarily available to help support any capacity building needs that could arise during the grant performance period. And then myself, I'm Ari Gregory. I am the grants manager, and my primary responsibility will be to kind of implement the solicitation process alongside my lovely team here at ECHO. Okay. So here's what I'm going to be covering in today's 1 hour info session. So first, I'm going to kind of go over some background information on where exactly this funding opportunity is coming from. Second, I will talk about who exactly is eligible to submit an application. 3, and this is where I'm going to spend the majority of my time today, kind of go over what this program is all about. Including sort of the anticipated award amount breakdown per awardee. And then, fourth, I will cover the overall application process, including the specific deadlines we set and the next steps once the solicitation will be closed on May 28th. And then finally, we have set aside time for Q&A. I'm hoping to have enough time for robust Q&A time. But if you do come up with any questions during my presentation, just feel free to post them in the chat. You can also raise your hand and either myself or my team here will try to, we'll be trying our best to answer them as they arise. And we can also address them at the end of today's session. Okay, so I'm going to start with some background information, like I said. So as many of you are already aware, ECHO as an agency, we're not a direct service provider per se, but we are the designated lead agency for the Austin-Travis County Continuum of Care, COC, geographic area, which in practice means that we are tasked with implementing a variety of HUD required activities. So for instance, coordinating the annual COC NOCO competition so that we can apply collectively for the federal COC grant funding administered by HUD. Also conducting the biannual point in time, the PIC count of people experiencing homelessness in our community. also helping support the COC governance committees and work groups, and many, many more. And so these activities are things that ECHO as an agency has been doing pretty much for as long as we have existed. But something we haven't always been doing, but we've kind of started to sort of experiment recently, so that we can try to help increase the overall capacity and effectiveness of our entire homeless response system, is to apply for and obtain pass-through funding, essentially, mainly from the private sectors, that can be passed on to our direct service providers in the community, who are boots on the ground, doing the hard work of helping our unhoused neighbors help end their homelessness. And as you may know, the Austin Street Outreach Collaborative, commonly known as the ASOC initiative, that was supported by the St. Davis Foundation in 2022. That was technically our first attempt or iteration of sort of this pass-through funding opportunity for us to be able to provide what we think is relatively flexible funding to be able to support crisis response services, such as CAs and SOAR assessments. And the Woodnix Foundation micro grants that we provided for diversion services last year, that was technically our second iteration of this attempt. And now we have this targeted outreach and program navigation services that would be technically our third iteration that we're very excited to talk about and share with y'all today. So before we dive into the program overview, let's talk about applicant eligibility. So ECHO will be accepting applications for this funding opportunity from either a 501c3 nonprofit organization, or in the case of a newer organization that may not yet have that 501c3 status obtained from the IRS, but is still interested in this funding opportunity, these organizations can still apply. What they can do is to obtain what's known as a fiscal sponsor. This is essentially an entity who will be able to lend their 501c3 status to that newer organization, so that newer organization will be able to still receive this grant award. And I did add a link on this slide that we'll be sharing with everyone today at the end, that you can go to that link and kind of find out more information about fiscal sponsorship in general, like what that is and how that fiscal sponsorship can be obtained. So I guess before we move on, any questions so far on applicant eligibility? We do think it's pretty straightforward, but I also wanted to make sure there's no questions in the chat. Okay. So I will keep moving on. Okay, so the program overview. And I'm going to start first with the target population. So who exactly is this program going to serve? Because this program that we're proposing, it does target a very specific group of unhoused individuals or families who do have to meet the following two criteria that you're seeing on the screen. So the first criterion is that to the left, the household to be served, whether they be an individual or a family household, they must meet the HUD's definition of chronic homelessness, which essentially means that the head of household have a long-term disabling condition, and they must meet the length of time spent being unhoused consecutively for the past year, or have had at least 4 separate occasions being unhoused in the past 3 years, that total a year. And again, this is the HUD definition. And the other criterion that the eligible households have to meet is that they must have already completed the coordinated assessment, the CA, and at time of enrollment into this program navigation program, they will need to be essentially at the top or close to being at the top of our community's PSH prioritization by name list. And this is something that is managed by, as many of you probably already know, Kat Hammer's team on a daily basis. Because once the PSH provider has a spot open in their program, this household will be referred to that PSH program for enrollment, which is oftentimes an administratively very time-consuming process that we're hoping that this new navigation program can help alleviate. So now that we're clear on who this program will be serving, let's talk about the whys. So essentially a problem statement, so to speak, of why we think we need this. So first and foremost, as y'all know, our homelessness response system, we really do have, we have many rooms for improvement. Now we know that funding for street outreach providers, or street outreach services that are so crucial to meeting people where they're at, it's very scarce, with no official programming available to help people navigate the complex web of homeless services, which in turn creates a lot of fragmentation within our response system, where there's little to no communication or coordination of services between the oftentimes overburdened street outreach staff and housing case managers. And obviously such, dysfunction is obviously very problematic for our unhoused neighbors, who would very likely get discouraged and may become distrustful because of the limited services provided on the streets while they wait for permanent housing. They may also experience a higher likelihood of getting ticketed or jailed just because they have nowhere else to go, all which would also likely translate to the worsening of their chronic health, behavioral health, and or substance use conditions. So in order to help alleviate all these issues, this program that we're proposing will be implemented in 2 phases. So starting with the targeted outreach to your left, the activities of which can be categorized in 3 broad buckets that we'll be expecting the staff members funded through this program to be able to engage in. So first, the expectation is for staff to be able to conduct intensive community outreach. So that means essentially doing whatever they can possible to try to engage with folks, meaning not just through phone calls and emails, but meeting people where they're at, perhaps at their encampment. The second expectation is that staff must be able to actively utilize the what's known as the BOLO process and the engagement processes, which are also administered by Kat Hammer's team, specifically by our PSH system manager, Dominic Phoebe. And this is to ensure that the proper engagement protocols are followed when trying to locate individuals on the by name list. And then finally, staff must be able to actively collaborate and coordinate services by, I would say at a minimum, attending all the PSH staffing meetings that are also facilitated by Dominique, for them to be able to engage in collective problem solving and thought partnership in providing the outreach services. So that was the first phase. The second phase to your right will be the navigation portion. So this is the portion where staff, they will be expected to collaborate with the PSH provider towards completion of what's called the PSH packet. So this is a packet that includes copies of IDs, chronic homelessness documentation, and also documentation of disability. So again, they will be expected to try to complete this in collaboration with the PSH provider. And we do also expect for them to be able to actively engage with other street outreach providers and PSH providers. That way we're making sure that whoever is being served will receive a warm handoff and a smooth transition into housing. So this looks kind of overwhelming, but this is kind of a more detailed list of the core activities that staff will be expected to engage in within the broad categories that I just discussed. So I'm not going to read through this list right now due to time constraints mainly, but I did want to mention that the expectation of grantees will be to ensure that all of these activities that you're seeing here, at a very minimum, that they are documented in HMIS, the Homeless Management Information System, for tracking and coordination of service delivery with ECHO, other street outreach providers, and the PSH provider. And if for whatever reason, your agency currently does not have access to HMIS, don't worry, because you're still welcome to submit an application, because we will be able to still coordinate access and training for HMIS for your agency if needed. So just to recap, both HMIS agencies and non-HMIS agencies will be able to apply with the expectation that we will be utilizing HMIS for service coordination. So the objectives of this program are essentially twofold. So the first one is, of course, we really want to be able to provide permanent housing as quickly as possible to clients by hopefully increasing the pace at which eligible households are engaged and navigated smoothly directly from where they're at into housing. And in order for us to be able to do that, collaboration and partnerships between street outreach and PSH providers are really, really key and very crucial, because in turn, this should lead to a more efficient and effective system through which eligible households are housed through the PSH program. Speaking of partnership and collaboration, which, as you may have noticed, it is one of the questions that we have added in the project application form. Here are kind of specific expectations of each of these actors, so to speak, within the PSH system. So let's start with the program navigator, which, just to be clear, this is the role that this funding opportunity will be covering. So the first one is to provide direct services. So this could be assisting with obtaining vital documents or coordinating basic needs support to kind of bridge that service gap between the point of referral and move-in through a PSH program. The other main role that we do expect that we kind of just went over earlier is to actively participate in the PSH staffing meetings. And this is so that we can kind of foster that collaboration. The role of the PSH provider in the middle is to be able to provide permanent housing and supportive services that the program participants will be able to utilize on an as-needed basis to support their independent living, as well as collaboration with the program navigators to ensure warm handoff. And like the program navigators to the left, we do expect PSH providers to be able to actively participate in the PSH staffing meetings as well. So in the meantime, what ECHO provides throughout this whole system or through this process are mainly, I would say, kind of back-end supportive services or supportive activities, including the creation of a contract or MOU between ECHO and the program navigator upon award. I do want to be upfront that we don't really have a whole lot of details to provide right now because we're kind of finalizing this part, but we do expect to be able to provide more information pretty soon on that, on this first bullet. The second role that we see ourselves providing is the kind of training and technical assistance provision that are related to program delivery. So this could be providing training on how to complete the PSH packet. And then the other role that we expect for ourselves is to coordinate referrals, for instance, pulling the names of households that are eligible for this targeted outreach and program navigation program into a PSH program. And lastly but not least, we also would like to try to provide any additional support that we may be able to provide that's related more to building the awardees' organizational capacity on an as-needed basis. Seeing no questions, I'm going to keep going. So here's hopefully the most exciting information that we're providing today. So the program budget that we have allocated for this program. And as noted on this slide, we anticipate being able to fund 2 agencies for the grant period of 2 years. And on this slide it says 2024, 2025, but knowing that it's already almost halfway through 2024, I would say in practice, this would likely be starting from mid-2024 up until mid-2026. And the budget breakdown you're seeing here on the slide is what each agency within those 2 agencies can expect to receive upon award. So we'll start with the staffing costs. So we have allocated a total of $150,000 each program year to cover the salaries and benefits of 2 full-time navigators. And I did the calculation, and this should come out to $63,750 annually for each navigator. And 0.15 supervision. So whoever's supervising these navigators, this should come out to $22,500 towards, again, a supervisor position. So a total of, yeah, so that was a staffing cost. And then below that, we have allocated a total of $37,500 for any costs associated with direct client assistance. So for instance, fees needed to apply for an ID. And then below that, we have also allocated the same amount of $37,500 towards any type of administrative costs, like technology or equipment that that the awardee may need to deliver the services. Okay, so still I'm not seeing any questions so far, so I'm going to keep going. So application timeline and next steps. So the submission deadline for this program application will be just about 4 weeks from today and is set at no later than Tuesday, May 28th at 5 p.m. And as I've kind of listed on this slide, we really wanted to try to increase the accessibility and, lower the barrier, so to speak, of this funding opportunity. And this is kind of knowing that increasingly we do have a diverse group of service providers in our community with a variety of, organizational capacities, including whether they have a dedicated grant writer or not. And that's something we've been hearing more and more. And so given that reality, we have kind of decided to try to accept the applications in two different ways. So the first option is for y'all to essentially go the traditional route and complete the project application form, like you would do for any other grant application. So, and I have provided the link here. So you can open that and it should download a Word document. You can fill it out, and you can email that to me at that address provided by the deadline. So that's the first option. Now, the second option, so this is a totally kind of want to be transparent and say that this is a totally new process that we've decided to try it out this time. And this is also partly based on feedback that we have received from past applicants for the flexible funding opportunities we had, is to allow the applicants to complete this project application form, the same project application form, except that they will do so verbally in an interview style format with myself. And as I noted on this slide, I will be just kind of as a disclaimer, I will eventually be summarizing that interview in a written format so that we can, we'll be able to score these applications kind of alongside the application submitted through option 1. But if this is something you would like to try, I added a note here that yes, I did want to request if you could please try to reach out to me no later than I guess it's next Friday. It's already almost May 1st, so that's next Friday. If you can, yeah, reach out to me by that date, that would be greatly appreciated. And the reason I've set that earlier is so that we can kind of coordinate this appointment and, you know, make sure that we have enough time to complete the application by the submission deadline of May 28th. Okay, so we are nearing the end. So once we close this solicitation on May 28th, we do kind of hope to begin reviewing and scoring all the submitted applications immediately in accordance with the scoring guide that we have published on our website. I also add the link here. And we do hope to complete this process no later than early June, fingers crossed. And then after that, we will move on to ranking and selecting up to 2 awardees who receive the highest scores. And we hope to complete this process by around mid-June. And once they are selected, these 2 awardees, they should expect to be notified by email of their awards. We will also likely make an announcement to the community as well. But when we send this email out, we hope to be able to include information that would not be limited to this, what you're seeing here, but it would at least include reviewing and signing of an MOU, what the funds disbursement method and schedule is going to look like, and any sort of reporting expectations we may have of that grantee. And once the MOU or contract is signed, we do kind of expect to start the process of training and onboarding of the awardees, which we hope to be able to tailor to each agency's needs so that each agency will be, you know, set up for success from the get-go. And we hope to complete that, or we hope to start that process around July. All right, so I think we went through that pretty quickly. That was all I had officially for this info session. So I wanted to open up for questions. Or I was going to say if Kat or Maya or Bill, if there was something y'all wanted to add. or chime in, you all are welcome to do so as well.
Erie, I would just like to say that although the deadline is this next Friday to submit whether or not you would like to try the alternative method of applying for the grant, you do not have to be ready at that time to do it. You just need to make sure that you've let Erie know that you want to do it before that time.
Yes, thank you for making that clarification. Yeah, that deadline was the May 10th deadline was exactly what Bill you just said, is for you to just reach out to me and start the scheduling of the verbal application. So yes, you do not necessarily have to be ready to do the verbal application at that point. I would honestly advocate or recommend that you may want to wait for maybe another week or two after that, just so that way you'll have time to look through the application thoroughly and like make sure you're hitting all the scoring criteria. Yeah, to make sure you can get like a high of a score as possible.
Erie, I'm just pointing out my email's wrong, so I put it in the chat. Not that anyone's gonna email me necessarily, y'all, but just in case.
Thank you. Sorry about that. I will.
She put my government out there, and it's really just Kat Hammer. Okay, thank you. All right, bye.
Thanks, Kat. Yes, ignore that email. I will make sure to revise this and make sure the revised version is uploaded on our website.
And it's my fault for not paying attention.
No, you're good. You're good.
It looks like we have a question, Ari, from Chase. Chase, I see your hand raised if you want to just unmute yourself and go ahead.
Yes, mine was just kind of off of what Bill was saying about the virtual. It actually reminded me to ask y'all, can y'all elaborate on that? That's kind of the first time I've ever heard of a verbal application. And I mean, I really feel like it's going to be of a benefit to some of the organizations that are not great writers per se, are not too familiar with the formal grant process or whatever, however we want to phrase it.
Yeah, thank you for bringing that up, Chase. So kind of the reason we decided to adopt this verbal application process is for exactly the reasons you actually just mentioned. So the purpose is to try to solicit applications from those agencies with primarily like limited grant writing capacities. We know there's a lot of organizations that out there that are doing this really hard, outreach and engagement work day in and day out, but due to a variety of reasons, maybe because they're very new to the system or they've never received any sort of training or education on grant writing, even though they may be really good at what they do, like the services that they provide are really good, just because they don't have that grant writing capacity, we didn't want to make that a barrier. And so, to be honest with you, Chase, like this is something that ECHOS has never done. I don't know if, any other grantor has done it either. So this is kind of an experiment and, we're hoping it would, again, kind of like lower that barrier and make it more accessible. So yes,
it definitely sounds like a great idea. And I'm actually, I would like to try it out. I would like to pilot it and see how it works. I feel like it may work in our favor by us being fairly still new. We're still under 3 years of it being a nonprofit. So, I mean, it's a great idea. And I'm really excited that you guys are exploring this avenue to potentially remove a barrier for some great entities that are out there. So great job. Appreciate you guys.
Thank you, Kate. Thank you, Chase. And we will connect separately to schedule your verbal application.
Do you see the question in the chat?
Yeah, I'm looking at it right now. So Kia, let's see, it says, how are we expected to verify that individuals have disabilities, and does that cover physical and mental? I'm assuming you're asking about when I was talking about the target population.
I can
So-
assist with this if you like.
Sure, yeah.
Okay, so for everyone who's going into permanent supportive housing, they have to have a verified disability, and we have to give proof of chronicity. Part of the technical assistance will be what's allowable and who you can get that. There's something called a disability verification form from HUD, and so we will go over this. And it can be a physical disability, it can be a mental disability, it can be both. And part of the TA will be supporting and figuring out how to do that and where to connect people to get that documentation completed. And that is kind of broad. Okay, good. That's a good, thank you. Is it Kia or Kia? Tell me.
I think it's Kia.
Hey y'all, it's Kia, like the car.
Okay, good, cool. All right, Kia, no worries. That will definitely be part of the technical assistance, and you will have to verify, but it won't be as complicated as you think it is.
That's perfect. Thank you so much.
No worries. Thank you for letting me make sure I got your name right.
Yeah, great question, Kia, and thank you for providing that great answer, Kat. Any other questions? And if you can't think of anything right now, that is fully okay, because as you may have noticed, y'all have our contact information already. And also, I did want to mention that I haven't mentioned yet is, so Maya and I will be holding virtual office hours for, and this is just like we won't have any presentation or anything, but this is so that folks can just hop on the Zoom call and ask any questions you may have about the process. And we are planning on hosting them pretty much every Thursday starting next week, not this week, but next week. And we'll do it during lunchtime, noon to 1. So you are welcome to, I think I put the link in here, I may not have, but if you don't have the link, reach out to me and I can provide that to you. So yes, there should be plenty of opportunities, hopefully, for you to ask questions if you have any. And yes, you can email me as well. Thank you, Maya.
And just to be extra, I think this is already clear, but just to be extra clear, these virtual office hours are not the verbal application. So even
yes.
if you have a verbal application scheduled, you're still very welcome to come to the virtual office hours, ask any clarifying questions you may have prior to your verbal interview appointment or schedule. And the one other thing to note about the verbal interview is we will go through the same exact questions that are in the written application, and will require the same attachments. So there are a couple questions that require a documentation. For example, the proof of 501c3 status or fiscal sponsor. So Ari will communicate all of this to you again in writing when you schedule your verbal application, but just to note now that you will have to have those documents ready at the time of your verbal application. You don't have to like verbally describe your 501c3 status. You still give the same documentation that would be required in the written. It's more so just you're not writing out your responses, you're talking through them with Ari, and then she's writing them out in a summary.
Can I add one thing, y'all? I just want to say
please.
that what's exciting about this, I think, too, is the creativity around the TA and adapting it to the specific folks who do receive the funding. And we know needs are different. So if you have questions about the HRS system, we're going to be able to tackle that and it'll all make sense. And so I think that that's normal, but I just want to say that like, there's no bad question, but we will definitely be addressing that in our adaptation for the TA, depending on who actually gets selected for the funding.
All right, so maybe I'll count 10 seconds if we don't receive any more questions. I can let y'all go early so that you don't have to stay here and offer silence. But I'll give folks a little more time.
All right, thank y'all. Y'all have a good day.
You too, Chase. Thank you for being here.
Awesome.
Thank you all.
Thank y'all for
Thanks.
showing.
Thanks, guys.